Welcome to On the Level, broadcasting from the Blue Ocean Network studios here in Beijing. My name is Fergus Thompson. Now, back in 2003, China was the focus of world attention as the SARS outbreak, which was thought to have originated here, threatened to spread worldwide. The initial knee-jerk response to cover up the effects of SARS was something of a disaster, but an abrupt change in government policy did see an improvement. Since then, China has successfully weathered a number of health-related crises, including several variants of bird flu. Well, today, the focus of world attention is West Africa, where the Ebola virus has already killed thousands of people and, like SARS, threatens to go further afield. Well, to discuss that situation and indeed China's particular role in combating the Ebola virus and its spread, I'm delighted to be joined today by Martin Taylor. Martin is the lead officer for Ebola Emergency Response at the WHO China office here in Beijing, where he heads up the Division for Health Systems and Collaborative Initiatives. Martin Taylor, welcome to On the Level.
Thank you.
Now, Martin, I do want to concentrate on the China-related aspects of this, but before looking at that, what's the general picture on Ebola at the moment? It seems to have dropped a little bit in the news cycles. Is that a good sign?
The general picture is that the Ebola outbreak in West Africa continues to be actually a serious public health emergency of international concern. Over 13,000 cases reported so far and over 4,900 deaths. This is the biggest Ebola outbreak that we've ever had. And it's particularly bad, of course, in the three worst hit countries which receive the media attention: Liberia, Sierra Leone and Guinea. But there have also been other cases reported most recently in Mali, in Spain, in the US, and two outbreaks which have subsequently been contained in Nigeria and Senegal. So the situation continues to remain serious, and a lot of effort is still required from the international community to support those three worst hit countries.
Now, we haven't had any cases in China as of yet, but what is the World Health Organization's role in advising the Chinese government here to try and avoid that eventuality happening? And have you given any particular special advice to the related authorities here?
First and foremost, of course, it's actually the Chinese government's responsibility to protect the health of the citizens of China, and they have been putting in place a lot of measures to do precisely that. WHO's role is to provide them with support, assistance and advice as and when they request. We've been providing some assistance and advice when they're planning their support to West African countries, and we also, of course, share information on a regular basis, including new information evidence globally, new global guidelines and lessons that are learned from other countries in containing Ebola.
All right, so it's a two-way communication process where you would provide advice if necessary, or if something does come up, you can certainly give them an idea of what sort of steps to take.
Absolutely.
Right. China is today Africa's largest trading partner. Africa as a continent, although it's often referred to in China as a country sometimes, but it is the largest. Given that, do you feel that the government response here in ratio to that footprint in Africa has been relatively adequate?
Early on in the crisis, WHO and the UN urged all member states around the world to provide whatever support they could to West Africa. China has subsequently followed up with 4 tranches of support, which total, I think, about $120 million in kind and cash contributions to the worst hit countries. Importantly, China's also provided really important human expertise from its own health systems: surveillance, laboratory, public health epidemiologists, and a mobile laboratory to Sierra Leone. This is particularly important because it draws on China's own expertise and is much, much needed in those countries. China, like other countries, can, and we would hope, continue to do more, not just now in the emergency situation that is faced in West Africa, but also in the longer-term process of helping build health systems in those countries.
You mentioned that figure there of $120 million in kind and cash, and also, importantly, staff. This is actually the largest response that China has given to a humanitarian crisis so far, it would appear. But again, in international press, you get this sort of competition of, China's a big economy now. Is that really enough? When you compare it to perhaps the United States, it's significantly below that. Is there much? Does the WHO sort of get involved in this? Who can hit the wall highest sort of attitude towards donations, or are you just grateful that people are actually doing something.
WHO's focus here is to actually mobilise as much support as we can globally from all countries. And in that sense, we're looking to mobilise not just financial resources, but also expertise. As is widely reported, in many countries it's lack of health workers that is a critical issue to help.
So that can be more important than the cash.
Absolutely. With laboratory workers, testing, surveillance, epidemiologists, it's all vital, because the main focus in those countries is to treat those people who have unfortunately already become infected, and that requires good surveillance and detection to identify them and to prevent future infections taking place.
A UN colleague of yours, Brett Rearson, he's from the World Food Programme's, he's a representative of that organisation here in China, said recently no one's been willing to do anything big yet, referring, it's generally thought not to the government here, but actually to industry, business, the tycoons. We hear about how many billionaires there are in China. Given the fact that many of these Chinese companies are working in this area and generally in Africa and making good profits from it, do you feel he has a fair comment? First
of all, leadership starts from the top. The fact that the government is taking a leadership role in this within China is very, very important, and that this is getting attention at the highest level of government will eventually have some trickle-down effect in terms of the rest of the community. Chinese businesses can and should be playing a role, and we would welcome that. We would encourage businesses around the world, not just in China, to do whatever they can. They have a responsibility with their own staff, first and foremost, but also with the communities within which they operate.
Something else that's been reported recently regarding Ebola and China has been the development of an anti-Ebola drug from a company formerly related to the PLA, that's the army here. Last that I read in the media that 10,000 doses had been sent. Now this is still early days, it hasn't been tested on humans yet. It may be tested in West Africa on this. JK05 is what it's been referred to. It's a drug, not a vaccine, importantly, so it's more at the curing end rather than the preventative.
Yes.
But I suppose the question is, from your knowledge of, does it work? Will it work?
Very good question. WHO is working actually with pharmaceutical sector around the world, of course, in particular to try to accelerate the process of bringing online new vaccines. With regards to this drug, we haven't been contacted by the national authorities and companies working with this drug. We would be very happy to do so if they wanted to work with us to see what can be happen to test and qualify and register such a drug before it can be used.
But as far as you know, doses have been sent to West Africa and it may be put in use at some stage?
We're not aware of the details of that.
Right. China's foreign ministry says the number of Chinese citizens in West Africa has dropped by half since August, something like 20,000 down to about 10,000. Now those Chinese citizens have presumably returned to China. In addition to that, Beijing, Wuhan and Guangzhou are three big airports in China, and they're amongst the top 25 destinations for passengers from Liberia, Sierra Leone and Guinea, those countries that you mentioned. Given that, as far as you are aware, what precautions have been put in place in China at the barrier level to stop the Ebola virus coming in here?
The World Health Organization at the start of the Ebola outbreak advised all countries that they should be putting in place the appropriate and necessary measures to detect and screen at the points of entry. China has actually in the last few years, not just in the last few months, but in the last few years, invested significant resources in beefing up their capacity to do just that in 259 ports of entry across the country to meet international standards for screening for public health risks. And that's been a long-term process in the last few years. In addition to that, more recently, of course, China has established clear guidelines and strong criteria for screening passengers who arrive from West Africa so that they can make an assessment of the level of risk and take necessary action if they need to.
Right. Anybody who's travelled in China virtually any winter since 2003 will be quite accustomed to having a sort of a machine aimed at their forehead as they go through, as they board the planes or leave the planes for temperature and so on. But what sort of screening is effective for somebody with Ebola, given that the symptoms are so similar to many other diseases? And are they effective, or is it just PR to make people feel better?
There are very effective measures that can be taken when passengers, travellers arrive. And those include a combination, it's basically a risk assessment, a combination of two factors. One, whether they come from the affected countries.
So targeting flights emanating from this area?
So, or people who have been within those countries within the last 21 days, and so therefore may have had an exposure, have had the possibility of an exposure, plus symptoms. Now, as you point out, that some of those symptoms, low levels of fever, could be Ebola, and it could be any other viruses or also other causes. So the first level of screening for people who have both of those is what's called medical observation, which is that they are then transferred and have tests to understand whether whether it is Ebola that is causing those symptoms, or if not, to identify what the alternative sources are. And that is the key kind of first level of entry screening.
Right. So that would, at least as far as the WHO is concerned, be something that is being done satisfactorily here. That is
the very first level that can be undertaken. And it's important to note here that the WHO guidance is that the countries put in place measures to detect and screen at the point of entry. That's the very first level that China, as with other governments, can do. There's, of course, a whole raft of other measures that China has taken within the health system as a whole for if an imported case presents within the country, i.e. somebody who walks through without symptoms but then falls ill at a later date.
Peter Piot, who's the director of the London School of Hygiene and Tropical Medicine, your alma mater, I believe, or one of them,
that's right.
Was quoted in the press as predicting that China will one day suffer an Ebola outbreak. Would you agree with his assessment?
For as long as there's an outbreak of Ebola in West Africa, there is the risk and the possibility of transmission to China as to any other country in the world. And the recent cases in Spain and the US have exemplified that. So as long as that outbreak continues, there is a possibility and a risk in China and elsewhere. And that's why it's so important that first of all, countries like China and others work as part of the global community to tackle the outbreak in West Africa, and then also to take measures to try to manage and mitigate that risk, improving the screening at airports and points of entry, and strengthen the health systems to more quickly detect if there is an imported case within the country. Right.
So you're not going to directly say no to him or yes, but you're going to say, certainly there's a possibility. I understand. Should the worst come to the worst and Ebola does arrive in China in significant number of cases, well, what is the worst case scenario?
China's put in place a lot of measures. We've just talked about detection and screening, but also within the health system. And there are a couple of important measures there, and China's recent experience, which really strengthens China's capacity to quickly react if there is an imported case and to prevent it becoming a widespread outbreak. Quickly detecting. China learned a lot of lessons from SARS to build up the public health system, surveillance system, laboratories, so that they could quickly test and quickly contain new outbreaks when they occur. And you referred to that, I think, in your introductory remarks with regards to China's experience with avian influenza at various times.
Exactly. What I was saying was, do these effects or cases in the past actually put China in a better position than many other countries to deal with something like this, should it happen?
There are two ways, I think, in which they can really help China. One is that China has a recent experience that it can learn from, and it helps China test and develop its systems further. And then secondly, of course, is the investment that China's put in since SARS to build up these systems. More recently, I mean, with regards to Ebola specifically, China has, the Chinese government and national authorities have worked hard with health workers across the country to disseminate information about Ebola, so that if a patient presents with possible Ebola-like symptoms or symptoms that could be caused by Ebola, that the health system and health workers know what to do. They know that they can quickly transfer those people to designated hospitals. There's a rapid response mechanism there in place, and China has tested that with drills to make sure. And you probably saw, I think, on China Daily today, there was a drill at Chengdu Airport our own representative.
One of several in recent weeks.
One of several in recent weeks. Our own representative, the WHO representative here, went a couple of weeks ago to the Beijing health authorities and visited a designated hospital here in Beijing, also to inspect and see the process of these drills and the plans that have been put in place.
It seems to have been reported or suggested that the spread of Ebola in the region that you mentioned in West Africa, in those 3 countries, was certainly contributed to substantially by the poor state of the health systems in those countries. And Nigeria, which would be considered to have a somewhat superior or better health system, seems to be clear of the virus at this stage. It seems to have rid itself of it. Mm-hmm. So from what you say, I presume you feel that the Chinese health system is in a reasonably robust condition if it were to face the worst. Then it has the resources, the backup, and it has systems in place rather than just ad hoc situations at hospitals.
Absolutely. The Chinese health system is much stronger, has a very different capacity and capability than those in the countries we're referring to in West mm-hmm. Africa. It's been tested with these other infectious diseases in recent years, and there's a lot of readiness planning that's gone on to make sure that the country is ready and on alert should an imported case arrive in China. Mm-hmm.
And indeed, as you mentioned earlier, there are Chinese specialists in West Africa, health specialists who are going there, who are veterans of the previous diseases, SARS and bird flu that broke out here. How important is their role in these countries?
It's important for two reasons. First of all, because the response in those countries is really testing the health systems. Mm-hmm. And so it's bringing in extra numbers of skilled experts who aren't available locally. And China, like other countries, is contributing there. So that's the first importance, is the extra number of workers available in those countries. Secondly, China's own experience of building up its surveillance systems, laboratory systems for testing and for rapid follow-up, epidemiologists. Those are important skills, and those are exactly the skills that are needed in those 3 countries mm-hmm. when new cases prevent, to try to quickly test, quickly diagnose, quickly put on treatment, but also follow up with the contact tracing and try and prevent further infections.
Right. As a more, let's put it this way, authoritarian government here, which can implement, for example, quarantines on whole cities, which might be more difficult to do perhaps in Canada or Germany. Do you think that is also an advantage that China has over other countries? Again, should this virus mm-hmm. reach China?
For a country to respond rapidly if there is an imported infection, it's important that the country has a good, clear, comprehensive plan with the right sets of actions mm-hmm. in place, and also clear accountability for who undertakes the various actions, so that people know what is necessary.
And who is responsible.
And who is responsible. Mm-hmm. And China has put a lot of effort into putting that in place. And that starts with national leadership from the top. There's a coordination mechanism with 22 agencies and national level authorities working on this.
In 2013, Xinhua, which is the state news agency which usually is giving the government line, said, if there's anything that SARS has taught China and its government, it's that one cannot be too careful or too honest when it comes to deadly pandemics. The last 10 years have taught the government a lot, but it is far from enough. Now, that was Xinhua a year ago, before Ebola had arisen. Do you feel that the government really did learn a very sharp lesson from what happened, certainly at the beginning of SARS back in 2003? Is that what has sparked all these improvements that you've been mentioning? SARS
was a wake-up, not actually just for China, but for the world, I think, in terms of the potential impact of a public health crisis on, first of all, on the health of populations, not just in one country, but globally, but also on trade, economic growth, tourism. China's government did, I think, 2 particular things following SARS. First of all, they invested considerable financial and human resources in strengthening those public health systems that can quickly detect a new infectious disease or an outbreak, so that they can then respond and mobilize the resources that they need to address that. Mm-hmm. Secondly, the use of accurate information, providing information, first of all, to populations, so that people know, are not confused, but have accurate information on symptoms and what to do.
This was learnt from the very early stages when the sort of no, nothing is happening response started off. Yeah.
Lack of information can lead to confusion.
Right, and they saw how seriously that could make things worse.
And with the preparations now for Ebola, with information being shared, not just for incoming passengers, but more broadly, and also importantly for health workers, so that health workers already have Ebola on their mind. If somebody presents with those kinds of symptoms through the front door, they're already thinking this could be a possibility.
The east coast of China is considered sort of the showcase, the developing or the developed part of the country. The cities here rivaling cities in the best of the West, or the, whatever you might say, the most developed Western countries. It's quite different when you get to further away from the coast and into the interior. Are these improvements that you mention in the system and these systemic sort of measures, they're not evenly distributed across the country, surely? Will there be more serious problems should that Ebola outbreak happen in a faraway country town rather than sort of Shanghai or Beijing where everybody is ready for it?
China has prepared a lot for the risk, the possibility that a case could arrive, which is what it should be doing, and which is what WHO would advise all countries to do in building up those systems. The first, we've talked about detecting at the point of entry. Secondly, strengthening the health systems across the country and having designated hospitals. Those drills as well that I referred to that China has done to test the systems, they will also benefit, of course. It's not possible to try and predict where a case may come up in the country, but the fact that there is a national response with national leadership and national plan, national level authorities and agencies like the CDC, the China Center for Disease Control, based here, but with a national remit, means that there is the capacity to respond and respond quickly wherever. President
Barack Obama will be meeting Chinese President Xi Jinping. They may have plenty to disagree about on other topics, but on Ebola it seems they would seem to be more or less on the same page. What do you think they will be discussing when they get to that particular topic, and what would you like to see, not just China, but the United States committing to coming out of that meeting?
There would be two main issues I would like to see discussed. One is continued commitment to the current response. Both countries have provided significant resources already, and we would like to see that continue to help address those outbreaks in the three countries in West Africa. That's the most urgent and important
so that they both
focus.
Continue along the lines that they have followed so far and cooperate.
To cooperate and also to demonstrate leadership to the global community. It's important to have both of those two countries demonstrating that leadership globally and playing their roles and playing their parts. The second is that the Ebola outbreak raises questions globally about the world being ready for future public health threats. And so consideration for how the world can better prepare for future public health threats is another issue for them to consider.
Again, if Ebola were to get some sort of a foothold here, what would be the ramifications in terms of these huge or this huge cooperation between the United States and China and Europe? Essentially, trade. If people are stopped travelling to places like the United States, it's going to be a huge economic impact. Is the government prepared for that? To actually sort of maybe halt travel or restrict travel to such an extent that it has that sort of effect? And would you support that, despite the economic pain that might come?
Good question. Two key points, I think, on that. The first is that, as I've already mentioned, the government in China has actually put in place a lot of measures to try and contain, if there is an outbreak, if there is an individual case in China, to contain it quickly so that there is not such a wide-scale outbreak. And with the health systems that China has and the preparedness that they've put in place, that likelihood of a widespread outbreak of the kind of scale that you're talking about is relatively low. Also, even for the worst affected countries right now, in West Africa, WHO does not advise travel bans. WHO advises that there be strong screening at the point of departure so that passengers who may be sick and who may need medical attention do not get on planes and do not transmit to others. WHO advises countries to screen at points of entry, but even for those worst hit countries right now, WHO is not recommending travel bans.
Right, but screening in the area where the disease is actually taking foothold is a lot easier to do than to screen everywhere where people from those countries are going to. But if people were leaving China, that's a lot more travel than would be from, say, just Liberia, Guinea and Sierra Leone.
The work and investment that the Chinese government has put in, building the health system and preparing it specifically for Ebola, means that China's actually well prepared to try and contain if there is an imported case, so that there would not be such a level of outbreak.
The countries where these sort of diseases tend to originate are almost, in recent times anyway, have been developing countries. So we could say maybe China was on the edge of developing back in the 2000s. What can, not just China, and China is now becoming a country that is playing an important part in the world in terms of humanitarian issues. What part can the developed countries do to improve the situation in these countries for their own good, to stop these diseases getting a foothold in poor countries like Guinea, and thereby, is there enough realization that it's not just going to stay in faraway places, that it's actually going to affect people in New York and in London and in Sydney or wherever else?
There's a lot that more developed countries can do, and already do, in fact, to help build up health systems in poor countries, many of which are in Africa. And a lot of resources have been invested, a lot of time has been spent building health systems in those countries in recent years. There was until the end of 2015, next year, the Millennium Development Goals, global targets for providing development assistance to the poorer countries in the world. 3 of those 8 targets were on health. Now, as we move forward, it's more important to shift away from targets on specific health diseases to broader strengthening and building of health systems.
And what was the rate of success in those Millennium Goals?
There was considerable progress in some of those, and we've certainly seen in recent years drops in malaria and other diseases. The challenge, and this is a challenge that China is already beginning to play its role in, is providing assistance to countries in Africa, but not just Africa, in Asia as well, to support the strengthening of longer-term health systems so that they're robust and can handle these kinds of epidemics in the future by themselves.
We do tend to see, wherever they emanate from, we do tend to see these epidemics coming up on a sort of a semi-regular basis. The stuff of Hollywood movies, the pandemic that decimates the world. But it has happened. The Spanish flu outbreak in 1918 killed tens of millions. Statistically, does the WHO see something like that happening within the foreseeable future? And are we in a better position now to mitigate the results of something like that?
With the global movement of people and around the world, there is always the risk, and there can be an increasing risk compared with many years ago, of the rapid spread of infections. But also the experience of the global health community in the last decades means that much more is known now. We're much better skilled and equipped to manage that risk and to address it with knowledge, with experience from other countries, with experience dealing with other infections in previous times. Plus, we have stronger health systems and better capacity and more science to help us manage and address those risks.
Martin Taylor, with that moderately optimistic view of the future, thanks very much for coming on The Level.
Thank you.